Welcome to the Editor's Podcast for the Journal of the Academy of Nutrition and Dietetics. My name is Dr. Linda Snetselaar, and I am Editor-in-Chief of the journal. Today, we are discussing the topic of food and nutrition security, and with me is Dr. Sara Bleich, who is the first Director of Nutrition Security and Health Equity in Food and Nutrition Service at the United States Department of Agriculture. Dr. Bleich is a policy expert and a researcher, and she specializes in diet-related diseases, food insecurity, and racial inequality with more than 180 peer-reviewed publications, including her name. Joining the Biden-Harris administration since its beginning, she first served as the senior advisor for COVID-19 in the Office of the Secretary at USDA, before then transitioning to her current role. Dr. Bleich was also a White House Fellow during the Obama administration, where she worked at the USDA as a senior policy advisor for food, nutrition, and consumer services with the First Lady, Michelle Obama, and her Let's Move initiative. Dr. Bleich, thank you so much for being with us today on this podcast.
Thank you so much for having me.
I want to continue with just a few questions, and the first to begin is, please would you share with us what drives you to work on advancing food and nutrition security?
Yeah, thank you, Dr. Snetselaar. It's great to be with you. I really appreciate the kind introduction and the opportunity to speak with your listeners. My core motivation for advancing food and nutrition security is personal. So I grew up in inner city Baltimore. I have a twin sister and an older brother. My parents were public school teachers. And when we were little, our family received SNAP, which was then called food stamps. We received WIC and received school meals for a period. So I really know firsthand the importance of the federal nutrition assistance programs. And now, in my current role, it is a huge privilege to have the opportunity to work on the programs that benefited me and my family when I was young. My parents have always encouraged me to give back and to do work that makes meaningful differences in people's lives. That is my North Star, and it is a key motivator to all the work that I do in this area. And from where I sit, I really think that this is such an exciting time for nutrition policy. From the president on down, there is a strong interest in advancing food and nutrition security, as well as advancing racial equity. And one of the reasons that we are at this inflection point is because of organizations like the Academy, which have been at the forefront of advancing food and nutrition security for decades. You know, when I first started in this new role, which was in early 2022, one of the very first meetings I attended was the Academy's Nutrition Security Affinity Group. And then a few months ago, I had a great time at FNCE, where I had the chance to participate in a fireside chat on food nutrition security and talk about the historic White House Conference on Hunger, Nutrition, and Health that happened this past September. So I am inspired by groups like the Academy who are leaning into this work. And right now, we have a window of opportunity to take the powerful nutrition assistance programs and do even more. So we need to take advantage, and I'm really excited to talk with you today and think about how members of the Academy can help with this effort.
What I'm hoping we might do now is take a little deeper dive into this new focus at USDA on nutrition security, and maybe start with the definition. How is USDA defining and then operationalizing nutrition security, and how does it differ from food security?
Great question. Really appreciate you asking it. So, a key message that I want to emphasize to listeners is that USDA is not abandoning our decades-long work on food insecurity. Instead, our nutrition security efforts build on our long-standing efforts to address food insecurity. So to directly address your question, which is how do we define nutrition security? It means consistent and equitable access to healthy, safe, and affordable food that is essential to health and well-being. And there are two key motivations for our nutrition security work. One is prioritizing equity, and the other is the recognition that structural inequities make it hard for many people to eat healthy and to be physically active. So specifically at USDA, we acknowledge that structural racism is a real problem for many people. Now, we are not naive enough at USDA to think that we alone can solve this problem, but we are honest enough to recognize that structural racism harms health in ways that can be described, in ways that can be measured, and importantly, in ways that can be dismantled. So we hope that our nutrition security work at USDA and our efforts to advance the goals of the White House Conference can really make a meaningful difference in this area.
Thank you for that very clear definition. Can you please expand further on how USDA is operationalizing its efforts to advance food and nutrition security, and then additionally help tackle those longstanding health inequities?
Yeah, absolutely. So we have a lot of exciting work in this area, and it's scaffolded by 4 pillars. And I'll go through each of those and give an example of each. So the first pillar is providing meaningful nutrition support from pregnancy to birth and beyond. An example here is the reevaluation of the Thrifty Food Plan. This serves as the basis for calculating SNAP benefits. This reevaluation resulted in the first permanent increase to the purchasing power of SNAP benefits since the Thrifty Food Plan was introduced 45 years ago, and it increased monthly benefits by 21% or $36 per person per month. This is a game changer for putting healthy food within reach for individuals in the SNAP program. The second pillar is connecting all Americans with healthy, safe, affordable food sources. Here, an example of our work is the Gus Schumacher Nutrition Incentive Program, which is also known as GusNIP. This program encourages the purchase of fruits and vegetables. Now, in the second year of the program, participants redeemed more than $20 million in nutrition incentives and reported increased fruit and vegetable intake, as well as improvements in food security. The third pillar is developing, translating, and enacting nutrition science through partnership. We refer to it as collaborative action for shorthand. An example here is how we work with the Department of Health and Human Services to regularly update the dietary guidelines for Americans, which serve as the basis for federal nutrition policy. And the 2030 edition of the dietary guidelines will be released by the end of 2025. And we will be announcing the 25 Dietary Guidelines Advisory Committee very soon. The fourth pillar is prioritizing equity every step of the way. And we also refer to this as equitable systems. An example of our equity efforts is how USDA's Office of Tribal Relations recently launched the Indigenous Food Sovereignty Initiative, which aims to promote traditional foodways, Indian country food and agricultural markets, and Indigenous health through foods that are tailored to American Indian and Alaska Native dietary needs. Now, these are just a few of many more examples of things that we have going on to promote food and nutrition security. If listeners want to learn more, I really encourage you to have a listen to Secretary Vilsack's historic remarks that launched off this whole effort in March of 22. We also released a report at this launch that details our approach to food nutrition security. And then another report that you might want to have a look at is one we released the day after the White House Conference on Hunger, Nutrition, and Health, which details who we are, who we serve, highlights key work underway, and how we aim to leverage the historic White House Conference. The report also touches on the role of the first White House Conference in 1969, as well as some of our key accomplishments during the COVID-19 pandemic. Another resource to have on your radar is that we have stood up new web pages that are continually updated that highlight all the different activities that we have underway. And it's an opportunity for registered dietitian nutritionists and others in the allied health community to understand how we are working to advance food nutrition security and where they might insert themselves to help drive toward these goals. And finally, let me also mention that all of our work at USDA is driven by research and it is grounded in science. It's woven into our policies, informs each of our decisions, and most importantly, it impacts every life that we touch. And we genuinely work to ensure that our efforts are informed by the lived experiences of those who participate in our programs.
I greatly appreciate USDA's focus on data-driven strategies. What does research in the area of food and nutrition security tell us, and why is that so important?
This is a great question. First off, one of the key reasons Secretary Vilsack has prioritized nutrition security is because of the pandemic and our administration's goal to advance racial equity. What COVID-19 did is it brought health disparities and the vital need for access to healthy food right up to the forefront. So, one study estimated that nearly 2/3 of COVID-19 hospitalizations in the United States were related to 4 diet-related chronic conditions: obesity, diabetes, hypertension, and heart failure. And evidence has demonstrated how disparities in diet-related diseases are associated with decades of structural limitations to retail food outlets that sell healthier foods. So, without question, promoting food and nutrition security is a critical ingredient to recovering from the COVID-19 pandemic and ensuring racial equity. And now, if we look specifically at food insecurity, the most recent report from the USDA Economic Research Service found that almost 34 million Americans lived in households that struggled against hunger in 2021. The report also found significant disparities. So, for example, the rates of food insecurity among Black and Latinx households were triple and double that of white households. But I do want to say the report had some good news. So, one is that the number of Americans experiencing food insecurity decreased by about 5 million from the prior year. Another is that food insecurity among households with children was at a 2-decade low, which is a testament to the power of the nutrition assistance programs at USDA, particularly in the context of the pandemic. Now, with respect to poor nutrition, there is ample evidence which tells us that it spans all demographics. So, poor nutrition is the leading cause of death in the United States and responsible for more than 600,000 deaths per year. There's also mounting evidence which illustrates how poor nutrition and diet-related diseases have far-reaching impacts beyond health. So, decreased academic achievement and increased financial stress as just 2 examples. And these impacts translate to society as well. So reduced worker productivity, weakened military readiness, and skyrocketing healthcare costs. So for all the researchers listening today, and all of those who are listening that are working to translate research into action, your work matters. And I encourage you to please keep us posted on your work, both the areas of success and the pain points. And please reach out to USDA if there are opportunities for us to support your work or if there are opportunities to collaborate. We greatly appreciate all the Academy does to lift up the important role of the nutrition assistance programs in communities around the country, both through research and through lived experiences. So please know that your voices, your research, and your translation matter.
My final question does relate to some of what you have been talking about. How might research in this area drive what practicing RDNs are telling their clients in more of a clinical setting?
I really appreciate this question. Let me think about 3 possible ways. So, first, building the evidence base and translating research into action is fundamental to our ability to accelerate progress on food nutrition security, as well as achieve the goals of the White House Conference on Hunger, Nutrition, and Health, which are to end hunger and reduce diet-related diseases and disparities by 2030. So, the first key thing I would say that Academy members can do in the clinical setting is to help encourage participation in the federal nutrition assistance programs. So that specifically means a warm handoff once patients screen positive for food insecurity. We know that our programs are not fully maximized. Only about 1 in 2 eligible for WIC participate, about 1 in 5 eligible for SNAP do not participate, and only a fraction of the children who participate in school meals are also a part of summer feeding programs. As trusted voices, Academy members can make a difference in this area. A second is to help lift up existing nutrition metrics like Healthy Eating Index in the work that you're doing. And I would also flag that the Economic Research Service at USDA, along with a number of other groups around the country, is working on developing nutrition security metrics, which will inform this work down the line. And the third is to prioritize research focused on advancing food and nutrition security among historically underserved populations. Specifically, it's important to identify how to best apply an equity lens and ensure that our approaches reach and resonate with the populations that we are trying to reach. SNAP-Ed could play a powerful role here, and a critical ingredient to SNAP-Ed's success is its partnerships. So many of you represent land-grant universities, local and state health departments, and many others who interface with SNAP-Ed, so you might look for opportunities there. And let me just once again stress the importance of keeping us at USDA up to date on your work. Please reach out and share your successes or ideas in helping us to maximize existing and new ways for the Academy and its members to advance food and nutrition security and to reach the goals of the White House Conference on Hunger, Nutrition, and Health.
Dr. Bleich, thank you so very much for sharing this information with us. I believe that this topic is so important. And as you have said, registered dietitian nutritionists can have a very powerful role in helping to advance what USDA currently is doing relative to foods and nutrition security. And finally, thank you so much for your leadership in this area.
Thank you so much for the opportunity to come and talk.